My name is Dr. Krystal Culler.
My name is Dr. Julie Radlauer.
I am the founder and creative director of the Virtual Brain Health Center, which is your one-stop space for understanding brain health science and what you can do today for your personal brain care.
And I'm the Chief Executive Officer for the organization called Collectively. Collectively is designed to support behavioral health professionals, and we do so through education, technical assistance, training, speaking events, and research. Work mainly with helping the helpers.
At the Virtual Brain Health Center, I think I can tell you our origin story. We launched as a response to the COVID-19 pandemic. At the time, I had trained previously as an Atlantic Fellow for Equity and Brain Health with the Global Brain Health Institute, which was funded by Charles Sweeney. If people had Charles Feeney, sorry, if you had heard of his work, he was one of the people that were very successful from duty-free shops, and he had the mantra of giving while living. So he donated his fortune to Want to See It's at Work and funded the fellowship. And they had modest grants out to fellows to come up with a small project of what they could do to help their community. And at that time, I had previous background, had worked in senior living and social model adult daycare care programs, and figured I knew what that meant, the pandemic meant for older adults regarding social isolation, loneliness, and ultimately their brain health. So if you think back to early days of March 2020, when people were thinking, oh, this was short term, I kind of leaned into my knowledge and knew this was more detrimental than we initially thought early on, especially for vulnerable populations like older adults and their care staff. And I thought, I knew I had a skill set, but I knew absolutely nothing about websites. So I applied for a grant to help someone build me a small website. And the Virtual Brain Health Center launched, serving my small community in Northeast Ohio. I'm in a suburb of Cleveland, and it grew beyond my wildest dreams. Social connection in virtual spaces can grow really far and wide. And now, to date, we fast forward now, we about 5.5 years old, serving people in over 125 countries, nearly every state across the US. Reaching close to now over 50,000 brains we have served through a wide variety of our educational outreach programs, our podcast, and other programs and services we do to teach people about brain health science and what they can do today. And when we launched, we had a very simple model. We knew Zoom had its limitations. Virtual programs would not replace in-person programs, but it would help substitute one area of people's overall health and well-being. And we wanted to fulfill areas of brain health that looked at cognitive engagement, social connections, personal well-being, and that physical movement piece of what we could fulfill in a virtual environment and create a space that could be one place people could come and connect. And one of our early stories early on when people came was like, my kids are not going to believe I'm talking to someone or in a class with someone in Canada and UK and India. So it's one more space where people can come together around the topic area of interest of wide variety topics in brain health and connect with like-minded people, learning together, learning from experts. We get to expand, not just experts that are in our local area now, but now global expertise can come in on Zoom, and we get to learn together in a community. And that's kind of been the mantra of what we could do. How can we translate the latest science from some of the brightest minds across the world to meet people where they are, which is now at home all across the world too, which somewhat blows my mind, being in my small office in Columbiana, a very rural area in Ohio, and connect people and learn together and continue to create programs and services for people and spark connections, spark conversations, and spark continual insights that we want to have within community and with one another. And so the work continues today, and making those connections, continuing to find new programs and ways to connect and learn, and we keep growing. And so fortunately, the work continues. Brain health is a hot topic. And luckily, over the last 15 years I've worked in the space, I welcome a challenge, but haven't found a topic that we haven't been able to really relate back to brain health. So more experts come in, more adult learners continue to come in, and we've even expanded our programs to children and youth as well. So anyone with a brain is welcome into our services, and we continue to find other like-minded partnerships to talk about our mantra, which is brain care for all.
At Collectively, the work that we do is mainly in community behavioral health, community mental health, and other systems. I started off as a licensed mental health counselor and was working with families in low socioeconomic communities and became really frustrated because families would come into services, get the support that they needed, transition from services, and then 3 or 6 or 9 months later, they'd come right back into treatment. And so I felt like we're doing something wrong. We really need to get ahead of this problem. So went back to school and really focused on the prevention of mental health conditions and conducted several research studies with families from across the country and said, are our systems working for you? And if not, what would work? And most families said what they want is they want their needs, their mental health needs to be met through their friends, their family, their faith, their community and through their social connections and social support. So that really is the basis of the work that we do at Collectively. And we use many different outlets to share information. So a lot of the work is training, helping professionals. We can do this both in person and digitally, as well as speaking at large events and keynoting at events to share tangible connections-based resources so that helping professionals can then use that information to work with the clients that they're working with and focus on social connections. Simple things in a systemic way, like adding a connection goal to every treatment plan. So we're not just focusing on what are some of the behavioral health needs that people have, but also what are we doing to help them build their support systems, because that will impact and help them have better connections, which will impact positively their mental health. In a digital space, one of the things that Collectively is, provides technical assistance really across the world is through what's called the ECHO initiative, which stands for Extension of Community Healthcare Outcomes. And it's really a digital platform where we bring experts to webinars where they present important information that's translated all over the world. So, for example, one of the most recent echoes that we did was talking about crisis intervention and how do we assess people during the crisis process. And we brought the statewide director of the 988 program to that initiative so that they could explain that when you're dealing with somebody who's struggling with mental health, you can contact 988 and that will be an avenue for you. And that's something that then was broadcasted available all over the United States to really understand the intricacies of the 988 system and how it can support mental health. So all of my work is really based in communities and how do we support those that don't have access to resources to get the same information that everybody else has access to impact their mental health positively, which usually comes through their social influences, which is social connection, social support, social capital, managing social media, and social inclusion, social justice. So all of the socials that we can use to improve our mental health.
I think one of the first things that I've learned that's been surprising through this work is the opportunities for collaboration and how much farther your work can go through collaboration, or we like to say collaborative partnerships for people, is how much farther it can go, where we like to say we can come together and raise the tide together. A lot of the work we do at the Virtual Brain Health Center is through collaborative partnerships with, I like to think, like-minded people as well as like-hearted people when it comes to this virtual space as well as social connection space. Is we get to go a lot farther together. I always joke that it's like building a Red Rover team where I want everyone on my team standing together and holding hands, because we just get to walk together forward and make the change so much more rapidly in this community space, whether it's virtual as well as in person. We're all striving together to have change and impact, and we get to do that so much more quickly, especially in a lot of the vulnerable populations that we're all trying to reach. And for many places where we're adding in this virtual component, sometimes it is for more rural areas or places that don't have a lot of funding or are under resourced. And this is just one piece of the puzzle that's trying to reach those populations, and it helps supplement other resources that communities are trying to get into. So if it's one way to come together, I always use that analogy. I want everyone on the Red Rover team in brain health so we can have an impact much more rapidly. And that has been, I think, one of the keys to our impact and success to our events, and the ways we get to do that is through so many different collaborative partnerships. And that's also how we help build out our resource library. And the resources is so we know where we can send people, whether they're looking for pay options that can go through insurance, private pay options, or just, what is an expert I can go to look for some information, or someone I can follow up with that will answer the phone and give me a response. Then they just keep calling in and get lost in between physical health services, mental health services. It's such a frustrating journey to be on and to get lost in between. And so, how do we help build those bridges so people stay on the path that they're looking for in brain health? Because everyone's entering this conversation at a different space, and we want to keep them on that path. We don't want to add to the frustration, and having those strong community partnerships and the bridges in place really help us go a lot farther. And so I have found collaborative partnerships to be very vital. And I also think in this virtual environment, one of the most amazing things has been the distance physically that we can have. Is, the time zones change, but like even having this conversation with you today, it can be recorded and people can come back and watch it at their leisure when it fits their time and schedule, and they're still able to access some information that can be helpful to them, or they can share it with a loved one, and they can listen while they're walking and doing something else, or they might be cleaning, but they're adding it into their routine, and it makes information more accessible in a variety of different formats. So it seems like it's a win-win. And so that's been something we've been able to do and get a little bit more creative of multiple points of accessibility for resources, has been the other side of the coin that I think has been a nice new learning, but also learning with our community of the ways they're asking for access and how we can get creative with some solutions for them, and the ways they're using the information lets us know how we can help better meet their needs as well.
One of the things that I've learned that really surprises me on a regular basis is I will conduct a workshop and bring in helping professionals, and they come to the session expecting to get tools for their clients. Like I'll share a workbook with them that has lots of different types of connection activities that they can use to work with the children that they're working with or the families that they're working with, to give them some tools for connections. But inevitably, people will come up to me afterwards and say, I came here for my clients, but I'm leaving with this information for myself. I'm going to use it with my mom. I'm going to use it with my own children. I need it myself. And so that continues to surprise me, because people think that, well, when you're in the helping profession, maybe you're not struggling with loneliness, isolation, anxiety, depression. And in reality, life is lifing these days, and everybody seems to be struggling at some level. And so I'm surprised uh, that how many people will need this type of work, and how simple it is, but how people don't realize that they have the ability to impact their mental health. What I really love about using some of the digital experiences that we've been able to create. For example, when young people are really struggling with anxiety and they don't want to be around other children, we've started group format virtually through, say, like Zoom. And one of the programs that we implement is called Be Socially Connected. So you meet on Zoom once a week for 5 weeks, and the kids get to know each other. So they feel more comfortable because they're in breakout rooms together and they see each other week after week. And then the last session is an in-person session. And so what that does is it builds community where young people maybe didn't have, they were too anxious to meet each other, but now they know each other through this virtual setting. And when they see each other in person, it's like you're meeting an old friend, which really reduces anxiety significantly. And so we've been able to do that in schools. We've been able to do that in communities, and expand the program. Another example is using Discord. So we'll work with having a therapist playing a video game on Discord and having a conversation about mental health. And so now we have young people who are saying, "Oh, what time are you going to be on tonight? Because I want to talk about whatever." And so just creating an environment and an atmosphere where we're meeting people where they're at. Young people who like to play video games will have access to experts while they're playing their video games through the avenues that they use. And that wouldn't necessarily be possible without having access to technology. My hope for the future is that everybody goes upstream, that we don't wait until people are really struggling before we offer interventions. And so I believe through the social influences, social connection and social support and social capital and managing your social media and social inclusion, we can give people the tools that they can use to connect with each other. I'd love to see aspects of connection embedded into all of our systems where schools are focusing on social connection, where your doctor, medical doctor is asking you about your social connections. When you go into the grocery store, you're focusing on talking to human beings and meeting people. I think technology can help by creating a bridge. If I'm concerned or I don't know how to access something, I can use technology to know an event this time of this weekend, and I can go there just to meet more people and support more people. I think that people are concerned about using technology too much, and there certainly is a lot of that. But if we learn how to manage it successfully and use it as the tool that it is, I think that we can continue to have social connections.
My hope for the future is that we all find that balance of social connection for our all optimal brain health and well-being, acknowledging that looks different for all of us on a continuum, and to remember that it's something we're all going to have to tinker with, and that will change across the lifespan for all of us. But to remember it's something so important to invest in for our optimal health and well-being. And I hope that others continue to recognize that even it's something simple. We don't need to overcomplicate the social health and well-being piece. There's lots of recommendations out there, and I think sometimes when we really look into it, we can get overwhelmed very quickly. But you can breathe, take a step back and make it really simple, and start off with just trying to connect with at least one person a day, whether that's a call, a text, email, a card, or grab a coffee with a friend. You can start with some really small steps and then continue to build out what that social health and well-being pillar looks like for yourself. A recent study came out in the brain health field where they gave a recommendation around the ideal window for social connection a day is about an hour that you spend cumulatively. So you can think about how all your connections today add up to that window and slowly build your way there. And so I hope that will be the goal for all of us of really building out our social health and well-being pillar into that interval, and continue to keep that open mind and tinkering with what those time intervals and the investments and who the people are that light up the smile on our face and make our hearts kind of shine for our social health and our well-being, and how we continue to do that for ourselves as well as give back to our own communities for that social uplift. And that is my hope overall, that we continue to value social health for our brain health.